Well, hello, everyone. I'm Teresa Blondin, the National Volunteer and Program Manager for Bladder Cancer Canada, and I'm honored to be facilitating this session tonight. This webinar is called Patient Perspectives, Your Questions Answered. So first of all, happy Bladder Cancer Awareness Month. Every May, we take extra time to raise awareness of bladder cancer and the symptoms among the general public and the medical community. We want everyone to know if they see red, it is so important to see your doctor. So I'm so happy that you're all here joining us to empower yourself through knowledge. At Bladder Cancer Canada, we believe that education can help facilitate and increase quality of life for people affected by bladder cancer. Tonight's webinar is a bit different than our normal educational sessions. Our experts are people who have firsthand experience with bladder cancer and are ready to answer your questions and share their valuable perspectives. So before we dive in, just a bit of housekeeping. Your mics and cameras will remain off for the duration of the session. However, we'd love to know who's here with us. So if you're willing, please drop your name and location into the chat. And please remember that webinars contain content intended for the sole purpose of information sharing and should not be considered medical advice. Always talk to your doctor and/or urologist about what is best for you in your situation. And if you run into any issues, myself and my colleague Shasa Boshoff are monitoring the chat and happy to help. So now I'm honored to introduce our panel for the night. Angela Peltier, Blair Faulkner, Peter Rich, Dave Somerton, Audrey Wall, and Ken Simpson. These 6 people are all incredible peer support volunteers for our organization, and I'm confident this session will be very enlightening. So thank you so much for being here and being open with your experience to really help benefit others. I really appreciate it, and I'm sure the whole community does. So we've received a lot of questions in advance. So what we'll do is go around the virtual room. We'll do quick introductions, and I'll ask some pointed questions to you about your experience, and then we'll move on to some general questions for the group. So anyone on the call is also welcome to type in questions in the chat box as well. Okay, so we will get started, and we will start with Audrey. So Audrey, welcome. Thank you for being here. And why don't you share a little bit about your experience?
Hey, my name is Audrey, and I'm from Saskatoon, Saskatchewan. It's a great day here. I found out I had bladder cancer December of 2017 when I was just about 60 years old. And it was such a shock and terrible experience for me just to find out that I had bladder cancer.
Yeah, I could imagine. Okay, so Audrey, did you experience any side effects with your BCG treatment, and did those symptoms change from treatment to treatment?
Yes, they sure did. My first few sets were a breeze. I felt a little fluish in the evenings. And my third set of treatments, I was starting to get nauseous. And I threw up 10 times one evening. And then I got a prescription from my specialist that was kind of for cancer patients, which was an anti-nausea kind of medication. And that helped wonderfully. No more throwing up. And I started to have more bleeding. And that concerned me quite a lot. And each time it got a little worse. So pain when I peed, and starting to go for walks was painful. And as it progressed further down the line, it was very painful to go for walks and when I had to pee.
Okay, and we have someone in the chat asking what type of bladder cancer you had and what was all of the treatments you received.
Okay, I had non-invasive high-grade cancer. So it was one tumor, and they took that out. And actually they didn't know if they went quite deep enough to get enough of the tissue around it to make sure it hadn't gone into the bladder wall, and it hadn't. But then I had bladder rupture actually because it went too deep, I guess. So there was concerns about that. Let me see here. So that's what I had, and I had BCG treatments for 2.5 years. And the first 4 sets were 3 months apart, and then the second year was 6 months apart. And then there was a shortage of BCG. So my last set of treatments, I had to wait an extra 3 months, which was very good. till I could have it, because then my bladder seemed to heal up a bit and bleeding stopped, and I didn't have as much pain with walking and different things. So it was much better then. So those were the side effects, I guess, that I had. And I've got some tips which helped me.
Yes, please. That's another big question. Any tips or tricks to help mitigate your BCG side effects?
Okay, so tips are drink lots of water. They tell you to drink water during that day, and I found out it really helped. And then as the pain became more, I drank more water the next several days, and that really helped to flush it out and help get rid of the pain, even though drinking more water makes you pee more. But after a couple of days, then there was less pain, I found, with drinking more water. And a huge tip is to go off coffee. For me, that was immense. Oh man, going off coffee, there wasn't as much burning. So I tried decaf first, and that helped. And then I totally went off of coffee for a while, and that really helped a lot.
Well, thank you, Audrey. So Blair, we'll move to you next. Please tell us a little bit about yourself and your experience with bladder cancer.
Sure. Thanks, Teresa. I was diagnosed just shortly before my 50th birthday, which was in February of 2018, with high-grade urothelial carcinoma. At the time I was diagnosed, they didn't know whether it was muscle invasive, which it turned out to be because I have artificial hips. So when they did the CT scans and such before treatment started, there was no real indication. They couldn't tell exactly what was being done. I got metastatic disease diagnosed probably about 10 months after the original diagnosis, after my surgery. I had gone through chemo. I had a neobladder done. I had a radical cystectomy, had my bladder removed, had a neobladder put in. That was all done in July of 2018. And here we are almost 6 years later, and everything has moved forward. It's not always been easy. However, it's not been horrific either. So I think that about covers in a high level.
High level. Okay. And did you have a choice in the neobladder? And if so, why did you choose the neobladder?
I was given a choice. The urologist that I had was fairly confident that he felt that I would do better with a neobladder because of my age, my activity levels, my physical. I was in pretty good shape. He suggested I go down that route, but it was completely my decision. So I went that way. It was certainly a longer recovery period, from what I understand from people that had stomas. But looking back at it now, yeah, it took a while. There were a few bumps along the way, but I don't think I regret. As a matter of fact, I don't regret doing what I did.
And a question about the neobladder. How do you know when you need to go to the bathroom because you don't have that feeling anymore? You don't know you have to urinate.
That's interesting. I saw that question that was presented, and I don't really have a great answer for it because it's been so long now. I don't really remember what that feeling was because you develop a new feeling. I certainly know when I have to go to the bathroom. It is every bit as obvious now as it used to be. You get the same sorts of pressures, maybe a little bit different. You void your bladder differently than what you did when it was natural, your real bladder. But I struggled with that question. I don't know that I can even answer that. I just, when you have to pee, and that's the best way that I can put it. One thing I will say is I know there was another question about that kind of coincides with this was the
maybe the urinary incontinence after the operation. That was another question.
Yeah, the incontinence. The incontinence is an issue. It takes quite a while to train yourself. It did for me anyway. I never had a problem through the day. The days were no problem whatsoever. Through the evenings, yeah, it took a long time for me to, when I say a long time, it took probably close to a year before it was really trustworthy that I could make it through the night, or, mostly through the night. you have to get up and use the washroom halfway through, but or at least I do. So, but yeah, that takes some getting used to. It does.
And so is that just, practice and kind of years of learning it, and that's why you've gotten to that point, or did you do something to help your body learn?
For me, it was just getting used to it. I'm not going to lie, it still happens occasionally. It's not 100% perfect. You have to really be careful about how much you drink through the evenings before you go to bed. It's not, I certainly don't drink nearly as much water as I used to. I just monitor how many liquids I drink through the evenings. The more you drink, the more problems you may have. You don't try and dehydrate yourself, obviously, but at the same point in time, you just have to be aware that sometimes it's not always going to be a perfect evening.
Right. Okay. A question about bowel movement since surgery. Do you have difficulties with that, or do you find the urge to urinate when having a bowel movement?
I don't know. I don't know that that's any different than it ever was. You usually 1 and 2 go together. I can say that. So, but I don't know that there's really any difference now than there ever was before. Okay,
great. Sounds like you had a really great experience with the neobladder. It's so nice to hear.
I did. It was, as I say, it wasn't all sunshine and happiness. But it is, I'm doing okay. I can't really, I kind of had the best of a shitty situation. So, pardon me, a bad situation.
We'll beat that out in editing. Okay, great. Thank you, Blair. So, Dave, tell us a little bit about your bladder cancer experience.
Hi, I was diagnosed with non-muscle invasive bladder cancer 10 years ago when I was 68 years old. And that was brought about because I spent years and years with frequency and burning and sensations. And basically nobody would ever listen to me until one time I went in to an emergency room and a doctor said, I'm going to get to the bottom of this. And so we spent the whole day and then finally sent me to a urologist. And we did a scope, and he discovered bladder cancer. And we tried a number of things during that period of time. I did a number of BCG treatments. They were unsuccessful. And then the gold standard at the time was radical cystectomy. And I had, in my mind, my brother-in-law in California was the 50th patient in the United States to have a Indiana pouch diversion, and he had it for 20 years without any difficulty or problem. So I asked the doctor if possible he could do an Indiana pouch, and he said, we'll try. And when I woke up from a very long surgery, I had an Indiana pouch. I've been very, very pleased for the last 10 years. I've had very little issue with the Indiana pouch. I've traveled basically all over the world. I've had very few people actually know I have that. And it's catheterized on a timely basis. I live by the clock. I don't have any urges. I don't have any sensation, but I've learned that I time myself accordingly, and it's been very, very successful. Unfortunately, I've just been recently diagnosed in the last 10 months with the UTUC, metastatic cancer, and I'm being treated now. I had chemotherapy and immunotherapy, and we have it on hold right now, and we're doing very well.
Yeah, I'm glad to hear you're feeling good today. We appreciate you being here. So what would you say are the main differences between the Indiana pouch and the ileal conduit?
Well, the Indiana pouch is internal as opposed to an external. There's no external appliance. I have a small stoma just above the belt line on my right side of my abdomen, and virtually if you wear a small bandage about the size of a 50-cent piece, virtually it's undistinguishable. You can swim, hot tub, do anything you did before without any problem. And so that was a real bonus, and I've enjoyed doing that for the last 10 years. And like I say, I've had very little issues with it. Occasionally, I had some issues with the internal pouch having a lot of mucus, but that happens, I believe, too, with even with the other forms of diversion. So, but in all, I'm very, very pleased with the entire issue.
Okay. Okay. And so for the Indiana pouch, you need to catheterize every like 4 to 6 hours. Is that correct?
That is correct.
Okay. Okay. Well, thank you. Now, Peter, tell us a little bit about your experience.
I was diagnosed with bladder cancer the spring of 2018. Treatments were not an option for me. Mine was quite severe. I had muscle invasive, high-grade bladder cancer. So I started off with, I think, 6 rounds of chemotherapy. And then during that period, they found that my bladder cancer had spread, so they restaged it from stage 3 to stage 4. The surgery was completed, I think, in November of 2018. That was to take care of the bladder cancer. I have a stoma, so I'm a bag man. I was given the option to have a neobladder or the ileal conduit, but the whole thing had been the chemo was very rough on me. I also developed, during the chemotherapy, I developed what they call steroid-induced diabetes. And so it had been a difficult journey. So I just, the thinking was that I just wanted to get this behind me. I just figured that if I had the stoma, external stoma, that I could kind of get on with my life quicker, rather than have to deal with other issues that come from certainly a neobladder. I just wanted to put it all behind me. So and then after that surgery, they discovered that the cancer, where it had spread to, the chemotherapy was so effective that apparently it did eradicate that secondary cancer. So it's been just over 5.5 years. I'm cancer free. Consider myself incredibly fortunate, incredibly grateful. My life has changed slightly. There's not many things that I can't do that I used to do before. I have to be a little bit cautious. But for the most part, nothing much has changed. I change my appliance now religiously every week, just before the weekend, on Fridays, actually. I have gone longer than that, but I decided to just do it routinely every week. I've rarely had any leaks or any problems during that period of time. Maybe 3 or 4 times I've had a problem. Because because I'm diabetic as well, I drink lots and lots of fluids. So I drank at least 3 liters of water every day, at least 3 liters. So my bag gets quite the workout, let's put it that way. But things haven't really changed that much. I mean, I believe that if you didn't know that I had a stoma and a bag, I don't think anybody would really know and notice unless I told you. So my stoma is located about 3 inches above my belt line, about 2 inches to the right of my belly button. One of the good things about that location is the fact that I can wear my bag vertically or horizontally. So I have a 2-piece bag, and I very often wear it horizontally. I have these things that I got from a maternity store called the maternity wraps, and I wear those all the time, and they keep everything close to my body, and I can wear pretty much anything I want. I can wear dress pants and a dress shirt and a tie, and and nobody would know. So yeah. That's
Okay,
it.
great. Great. And so you've kind of mentioned some of it, but what would you say are the pros and cons of the ileal conduit?
Well, as I said, I think the pros are the fact that I was able to readjust to a new life, hopefully cancer-free, more quickly. I was in hospital for about a week after like a 7 or 8 hour surgery. Within I think it was 2 weeks after my surgery, I drove to out west, not out west, but I went to see my daughter for Christmas in Mississauga. I live in the city of Toronto. And I remember 2 months after my surgery, we went on a vacation to Cuba. So, and I was swimming in the ocean. I was doing everything that I wanted to do when I got there, kind of thing. And the cons, I'm not really sure if I have to have cancer, if I have to have bladder cancer, and this is the route I took. I don't think there are any cons for me. I believe I've adjusted very well, and my life has gone on, and yeah, I'm very happy with the decision I made. So. Yeah.
Great. That's a great outlook. So you answered another question that came up about swimming and hot tubs. There's no issue with an ostomy bag and using and going swimming or going in a hot tub?
Well, I usually don't swim in the hot tub. I usually just kind of relax. I'm not sure if that's what you meant. No, seriously. There is a product that you can get that comes from 3M called Tagaderm. And Tagaderm is the kind of dressing that they put on you when they give you an IV in the back of your wrist or something like that. It's a very clear, very strong tape. And so I usually cut that into like 2-inch strips, and I place that all the way around my appliance, and it's totally waterproof. It's actually very difficult to get off even after a week. So yeah, I've never had any problems. Never had any problems because of swimming or anything like that.
Okay, great.
Yeah.
And how do you manage the frequency of urination?
Well, other than the other gentlemen that don't have any signals, mine's pretty obvious. If I'm limping one way, it's usually because it's an extra weight or something like that. But I'm constantly feeling my stomach and the bag to see how much. But as I say, because I drink so much water, it's quite frequent. But it would have been frequent even if I still had a bladder, get from the diabetes. So yeah, it's been the only issue that I've had. And I'm just being honest here. The only problem that I've had, I was hospitalized once with a kidney infection that ended up turning into E. coli. And that was a result of my apparatus, I guess, if you will. I don't think it's anything that I did wrong. I think it's just something that can happen. And actually, right now, I'm on a course of antibiotics again because I now have another kidney infection. This one's not as serious as before. So yeah, it's a little. So if that's a con, that's the only con I really have. But hopefully it'll clear up soon.
Yeah, hopefully, I'm sure it will. Okay, thank you. Now, Angela, tell us a little bit about your experience.
Hi, I'm Angela. I was diagnosed the end of 2019. I just turned 38. First when I was diagnosed, it was high grade, non-muscle invasive, but I also had carcinoma in situ as well showing up. For all of 2020, we tried BCG. I had 4 TURBTs, and then by the end of 2020, it became muscle invasive. So then I had the radical cystectomy. Well, I had, 12 weeks of chemo and then the radical cystectomy, and I now have the urostomy, the ileal conduit. But I've been no evidence of disease since. So I have a few things I was going to add to what Peter said. I have a little bit of a different routine with mine. I change every 4 days with my pouch, and I was actually quite amazed when you say only once a week. I think my adhesive would stay on that long, but I do notice it starts to get a lot of wear, and like it doesn't, like the pouch doesn't feel as nice and fresh for me. So I tried to stretch it, and then I don't think I like it. Like I want that new bag feel, that new fresh. You probably know what I mean, Peter, but like that new fresh feel. It's like, this is better. Okay, that sort of thing. So 4 days seem to be the magical number for me, but I have no leaks. I don't do it because of leaks or anything. It just seems to be what fits like my routine.
Okay. And did you have a choice on your diversion?
I did, I did, I guess, but kind of my urologist definitely said, let's go with a urostomy. That's what he does, that sort of thing. And I researched myself to see what the other kind of diversions there were, and I asked him about the neobladder, and then he said, oh, I don't do many of those, but I have a colleague that like specializes in it. You can talk to him. And for me, I was really comfortable with my urologist. So when I talked to the other one, it's like I didn't have that, it didn't feel right for me. I didn't want to go down that route. I also didn't want to, I was afraid that I would have to do the self-catheterization because I actually have spina bifida. So I've been self-catheterizing since I was 3 years old. Had a lot of UTIs, that sort of thing. So I kind of know that, like that world of things. And I was kind of happy to let it go. It was kind of like, oh, that might be something I still have to do, and there's going to be other problems with UTIs and things, and I've already had like a long lifetime of that. So I actually have probably a little bit more freedom with my pouch these days. I was able to say goodbye to catheters. So
Yes.
so I did have the option. It's just the urostomy seemed like the better fit for me.
Okay, great. And same question for you regarding bowel movements. How have those been affected since surgery? Do you have any difficulties? Things like that?
I had difficulties right in the beginning. So even after surgery, and this is something that has come up in the women's group, is sometimes we have difficulty. I was 10 days after my surgery, and I was still in the hospital by the 10th day. And it was really because I hadn't had a bowel movement yet. And they wanted to make sure, everything was all connected right, and everything was flowing properly. And I did, with some assistance. I think it was a fleet enema that did it. So we knew, okay, the piping, everything, that all works great, but I've been having a lot of pain in like since then. So I get like gas and cramping, and I don't, this is what we've kind of figured out is, everything gets taken out, everything gets piled back in, and I think it's just not put back quite the way it was. So I have what I think is like just one little corner that if stool is going through, it sometimes struggles getting through there. That gives me pain and a little bit of pin gas. Not really sure. Like I talked to my urologist about it, and same idea. He said maybe raw vegetables, certain things that can do this. I don't really know what my trigger is. It's just every other week. Sometimes I have issues that I'll have a bit of gas, pin gas and pain. And that's just been kind of mostly since the surgery. So I don't know if it's like anything I can do with it, or just, it's there now.
Okay, and as you host the women's support group, so you talk to a lot of other women in a similar situation. Is this something you hear frequently?
Not frequently, but a few have, yeah. Because one other lady was like, "Oh, I bet you had diverticulosis." I think it was. She was like, that was the issue that she had after. So there's a couple of us. I wouldn't say it's frequent that it's everyone, but definitely a few people have said, "Yeah, I had some issues," or they had temporary issues, or like they were having some trouble with digestion and everything. And then I think once after the surgery, everything calms down, then they kind of get back to normal again. So things like Restore-Lax or stool softeners and things like that might help it be a little bit more gentle in that beginning when you're starting to heal.
Okay. And what would you say to other women who are going through a bladder cancer diagnosis and how to navigate it. Any tips or tricks? Maybe Audrey, you would have some too as well. You know, this is bladder cancer has been typically known as a male disease, but we are noticing more and more women being diagnosed. But I do feel we hear that women sometimes feel a little bit more alone in this process. So anything you would want to say to women?
I would say to try and join a women's group. Like I said, if we're hosting it, I think there's 77 of us across Canada right now. It's a little hard. I know, like, Canada's huge. So like the time zones is a little bit tricky, but I would suggest it, if you can't do it all the time, to join even for a month or two, or try to connect with other women, because they definitely have a wealth of knowledge and a lot of answers, a lot of experiences. And sometimes, as we all know, these questions are a little bit uncomfortable. And in my experience, the women are all very comfortable with sharing the good, bad, and the ugly. So I think getting that kind of woman to woman kind of questions and getting intimate with it is really helpful.
Okay.
Yeah, and for me, I didn't know about Bladder Cancer Canada. I didn't know that there were peer support groups at all. And I struggled feeling all alone. And that went on for the first couple of years. And I had friends and family that were trying to encourage me, of course, and that was good. But to be able to talk one-on-one with different support groups has been immensely helpful. So that's why I love being the Saskatchewan, Manitoba peer support lady. And yeah, we have men and ladies in our group. And it's just so nice to be able to chat with each other, tell our conditions and experiences with it and tips. And it's just been, yeah.
Okay, great. Thank you. And circle back to Peter. He had something to add about the previous question, I believe.
Yeah, just based on what Angela was saying, because I have a two-piece appliance, what I do, and I've done right from the very beginning, is every morning when I shower, I remove the bag from the seal, and I rinse that out as well. With some vinegar, white vinegar and water, and I just give it a slosh around, and that seems to keep everything fresh, and so I don't have any problems, or I don't have any thoughts in that direction. That's just a force of habit. I've been doing it from the very, very beginning. But I think it takes experimentation to. It probably took me about a year to go from like changing every 3 days, and then 4 days, and every 5 days, and there was a time that I was actually going 2 weeks. And I figured that was probably too long, but I as I say, I was rinsing every single day, so I felt fresh, but as I say, it takes different products behave differently, and I think that I've now got a formula where the products I use now, I've been using for about 3 years consistently, the same product every time. And that's where I can get to the 7 days. So
I want to add to that. That is probably the difference. I use a one piece. So for the attendees and here, if you're wondering about the different pouching systems, I do the one piece. So I can't take it off and kind of get that refresh or that little cleaning, because once I take it off, the whole thing has to come off. A whole new one needs to come
I
back
see.
on.
Okay.
Yeah. And I do that because I found that, like you said, you got to try different products to see what works. It had a bit of a lower profile, so I felt like it was a little bit less noticeable on me. I'm really short. So for me, it was like some pouches seemed really obvious for me. And the one piece gave me a little bit more of that lower profile to be able to hide it a bit better. But with that, you can't clean it as well.
So I mean, we can chat amongst ourselves, Angela. We'll just leave everybody out of this. So how far does your stoma stick out then?
Mine is not out very far. It's this much off, maybe. It's a very small stoma, so I use a light convexity on mine to help push it out a little bit.
Yeah. And mine sticks out about 3/8 of an inch. Probably about the same as yours.
Okay, yeah,
Yeah.
it's a small, it kind of goes, once I take the pouch off and it relaxes a little bit, you know how it kind of moves a bit in and out. Mine
Yeah.
will relax a bit and go a bit flush. It won't go in, but it will go a bit flush. So then I do the pouching with the light convexity to kind of like push it out
Okay,
a
so
bit.
last question. Have you given your stoma a name?
I have. I named mine Beatrice.
Beatrice? Oh, that's good.
Beatrice.
Okay, mine is Flo.
Oh, that's good. Good. I like it.
Okay.
It's
Sorry.
flow. I
Thank
love
you.
it.
Thank you.
Okay, one more question for ostomies, which you did mention, Peter, but maybe Angela can add, or any other tips or tricks for wearing clothes comfortably. We have someone who said they have to go back to work now, and they've been used to wearing jogging pants, and they're not sure how they're going to make jeans work.
Yeah. Okay. I know, Peter, you said it was kind of not different for you. That was not the case for me. I actually found clothes probably the biggest challenge for me. Dresses, great, love it. You can't tell. No one noticed a thing in a dress. Pants, I've not been able to do very well. I find jeans a little bit uncomfortable. And the times that I do it, I don't find my pouch flows as well. So I'm constantly having to maneuver it and kind of shimmy it down, I guess. Um, so I've been needing to wear like a high waisted pant. You know, as a woman, it's kind of easier. Leggings, it's easy to do, that sort of thing. Or you can get jeans that don't have a zipper or button, but I've not been able to do the jeans and zipper like the way I would have done previously. I find it uncomfortable. But I do want to add again, I'm 4'10", so there's not a lot of like, it hangs a bit low on me. I've seen it on other people who are like an average height, and it's not hanging as low. It's not quite as noticeable. So in clothing for me, I had to learn what works for me and kind of change up my style a little bit. So
Okay, well, thank you so much. Now we will move to Ken. Tell us a little bit about your experience.
Hi, I'm Ken. I'm from Ontario. I was diagnosed with muscle invasive bladder cancer in June of 2021, and that was during COVID. And I went and saw my surgeon, who told me the diagnosis. And I should say that the first how I detected this was blood in my urine one morning. And my wife sent me to the clinic the next day. So I have to thank her for that. And so off I went and saw the surgeon who gave me the diagnosis. And I went home and did some thinking and a lot of research. I went back and saw the surgeon who wanted to give me, remove my bladder. However, I didn't really want to do that. And I pressed him to find out if there was any alternatives. And lucky for me, he went like this. He says, I know a guy in Toronto who's doing a clinical study, who I went to see. This was after chemotherapy at the hospital up here in Barrie, and I received great treatment there. So I did go down to Toronto and was interviewed by the doctor, and I guess their committee decided I was a candidate for the clinical study, and I joined it. And it was a randomized study. Half the patients got the new drug and half didn't. Well, I did not receive the drug, but however, I did receive chemotherapy, radiation treatment for 21 days. And at the end of all that treatment, they told me that my tumor was gone. And that was a happy ending for me. I continue to see the doctors every 4 weeks, and now it's every quarter. I get a cystectomy every quarter, MRIs, some of the other local CT scans that you would normally get. And right now I'm cancer free, so I've been very lucky. And yeah, I can only give hope to those who have to think about seeing their doctor that there might be alternatives.
Yeah, so, the standard of care is still a radical cystectomy, but it's, it is nice to know that there are options and that bladder preservation is one of them. So what would you say to other people on how to advocate if they, are determined to keep their bladder, keeping in mind that there are specific criteria for people who are eligible for this bladder preservation treatment?
Well, yeah, there is specific criteria for it. Fortunately for me, I fit that criteria. I went to a presentation about 3 weeks ago in Toronto, given by Dr. Sridhar, who is running the study. And I learned during this presentation, which I didn't know before, that the criteria is very strict, and I'm just so lucky to fit into that criteria to be able to keep my bladder. And I guess lucky for me, it was muscle invasive. They did remove most of the tumor, not all of it, because he did not want to damage my bladder. And I guess radiation and chemotherapy took care of that. I've been very lucky and thankful.
Okay, great. We did just receive a question. Have you received or experienced any bone density issues or pelvic fractures after radiation?
No, but I do experience neuropathy. And I believe that's quite common with folks who receive chemotherapy and or radiation in my feet and my hands. But that, I get up in the morning and I'm happy to get up in the morning. So that's a minor thing to think about. No, I don't experience any bone density issues. I do cut myself occasionally because I don't have the feeling in my fingers that I used to have, but that's okay. Yeah, it's really very positive for me right now.
Great. That's a very lots of nice experiences here, which is a really nice thing to share with the community. Okay, so now just some general questions. So feel free to just put your finger up or start speaking. So first question would be any tips or suggestions about maintaining your sexuality after a radical cystectomy? Any complications or any tips that you may have? Yeah, Dave.
That's one thing that people should be very aware of in the male population anyways. Radical cystectomy normally involves removal of a lot more than just the bladder, and you can usually suffer from ED as a result of that. So those are questions that you should be addressing to your surgeon when you're talking about any form of radical cystectomy. What are the implications post-surgically sexually? It's very important. It didn't happen. I wasn't aware of a lot of it till after the fact, but it's something that should be addressed. And it's not dealt very much with in Bladder Cancer Canada either. It's a subject that is very, very important, and I'm sure a lot of people across the whole spectrum have issues in various different styles with, but it is a fact.
Well, and good news, we did presentations on sexual health with Dr. Nyack and Dr. Kokorovich in the fall, and we're working with them right now to develop a really comprehensive sexual health resource. So that should probably realistically be out early 2025.
Excellent.
Yeah.
Can I just add to that? It's funny you bring that to a very important point. When I went to see my surgeon, I took my wife with me, and we both sat and took notes. And I had done much research before our visit to the doctors. And one of the questions that I did ask was about the sex. How does it impact on your life in general? Swimming, sexual activity, sports. We're pretty active people. And after I did receive the answers to those questions, made me more adamant to say, give me an alternative, please.
Mm-hmm. Yeah, I do hear a lot of people surprised when they are getting a radical cystectomy about all of the different things that are removed and maybe not clearly expressed to them. So That's a good point. Always making sure you ask your doctor as many questions as possible. Audrey, I think you were going to say something.
I have a comment there too. With my BCG treatments, they advise you not to have sex that day or for a few days after, I guess. And anyway, as my treatments progressed on, there was more and more pain, of course, with peeing, and also pain with sex, especially at the very end. It was very painful, and to have sex. And I just thought I'd mention that with the treatments. And it took a while actually till yeah, we could have the sex. So that part, yeah, it takes a while for that all to heal, I guess.
And you know, that does kind of, it's rational when you think you're inflamed, right? That's what BCG does, is cause that inflammation. So it would make sense that it would be painful.
I just want to add, I didn't hear it from my urologist, but I've been hearing it in the women's group that there are some organ sparing that can happen as well that you can ask your urologist. So when I had mine, he said, okay, you're going to have a hysterectomy now. Your uterus, your cervix, urethra, everything's coming out. He's taking it all. He did leave my ovaries, given that I was so young. He didn't want to put me into menopause so early. But I just took that as that. I'm like, okay, I'm losing all these things. Okay, that it's just that. But as I speak with other women, you can actually talk about organ sparing, and that is so that less things are taken out and not as many chances of having the nerve damage or sensation that's maybe taken away, that sort of thing. So that's something that people can ask their doctor if it's an option.
Okay. Have you had any recurrences? If yes, how long after the first resection, so the TURP, and what happened after the recurrence? Blair?
Me?
Sure.
I had so because they didn't really know, because of my artificial hips, they really didn't know how invasive it was or how far along it had gone. So when I went back for the first CT scan after the radical cystectomy, they found a couple of lymph nodes that were enlarged that concerned them. And so they sent me for a PET scan, and then that showed where it was in my lungs and in the lymph nodes as well. So for me, it was, it was all in one calendar year. It went from just, everything should be fine to, oh yes, it's all through you. You have metastatic disease. And prognosis really wasn't particularly positive. At the time, they gave me immunotherapy as kind of a Hail Mary, so to speak, because it wasn't really it wasn't a frontline course of action at that point in time. It was just starting to come online. Fortunately, I had a complete response. So the first scan I went to after that, it was gone. So yeah, for me, it was very quick. It was there in less than a year.
Yeah. Well. Okay.
I've got
Could I say, in my case, I was basically, as we all say, cancer-free for almost 10 years, followed annually by the surgeon. Started off with CT scans annually for about the first 4 or 5 years, and then we went to CT and then ultrasound. And the cancer was detected by accident because I had what I thought was a sore hip. So my doctor sent me for a CT. And this was last year. And when the CT came back, they noticed a very small spot on the tip of the liver. And they thought, well, we better check that out. So we did a biopsy, and sure enough, it was cancerous. And as a result, I'm now diagnosed with upper tract urinary
Urothelial carcinoma. Yeah, that's a tough one.
Carcinoma, yeah. UTUC or whatever it is, yeah. And,
Acronyms easier. Yeah.
so I think, like anybody who undergoes a radical cystectomy, should be very certain to ensure that the follow-up at least should be a CT, because ultrasound won't pick it up. And had perhaps I've been getting a CT maybe a couple more years ago, it might not have been as drastic as it is now. So that's something that, you know, you want to talk about when you talk about follow-up. You know, that's the only, it was caught by accident. I could have gone another couple of years and I wouldn't be talking to you at this point. So luckily it was caught by fluke.
Mhm.
I was just going to mention that at the beginning, I had 3 months checkups and then went to 6 months, and now I'm on the yearly checkup, and everything has been totally good. I've been so happy. So BCG was a good way for me to go, even though there was some pain, but I've been so thankful that there's been no reoccurrence. And bladder cancer is one that can come back very easily. What's the percentage? I think it's 70% or
60 to 70, yeah.
Mhm.
so I've had no reoccurrences. So the BCG was great for me.
Yeah, that's awesome to hear. Anyone else have anything to add about recurrence?
No, I can just can add one thing. I'm on a 6 months review. I go to Sunnybrook Hospital. I go every 6 months. My my oncologist before I even started the routine checkups, this is immediately after the surgery and things like that, she pointed out to me that I was somehow very fortunate because I was now in the system, and that they would be checking up on me probably for the rest of my life as long as I stayed in town, and that if they found something that hopefully they'd be able to deal with it straight away. And she pointed out that even with bladder cancer, there are some people that come in to see her, and it's just too late. And other cancers have shown up within the body, and so in a certain way, there's kind of a bit of a silver lining in so much that I feel confident that because I'm on a 6 month frequency, that if they find something else, it'll be caught early enough to be able to deal with it. Whereas, you know, if I was on a longer or no checkup, I know people that after 5 years they come back and see us if you have any problems, you know, things like that.
Yeah, that's a good way to look at it.
Yeah, and I also think that the fact that you know, as a peer support volunteer, the calls that I generally get are the people that are going to lose their bladder. But I'm actually amazed and somewhat disappointed that a lot of them have had a journey that may have lasted, you know, 3 or 4 years of treatments and treatments and treatments, and it just gets to a point in the end where their surgeon or oncologist says we've tried everything and now it has to go. And you know, when I first I shouldn't say recovered, but when I first came out of hospital, you know, every headache was brain cancer, you know, every backache was kidney cancer. Like it's a difficult way to live, but you get used to it after a while, after they keep giving you a clear bill of health. So thanks, Teresa.
Yeah, well, that actually leads kind of perfectly into the next question. How do you remain optimistic during treatment or after, and how do you mitigate stress levels?
You have to stay optimistic, because if you don't, you drive yourself crazy. You really truly would. This is going to sound as a strange topic or strange way to put it. My wife actually had breast cancer about a year before I was diagnosed with bladder cancer. She's fine. She's 7 years out. She's recovered quite well from the breast cancer, and she came through it like a trooper. And she was in the end, much sicker than I was on the couch through chemo. But I had her to look at and say, okay, she did it. Who am I to sit here and mope for myself? You know, it's not a great way to go through life, but anyway, that was our situation. So, but you know, I've got a friend of mine that has, you know, he's got metastatic colon cancer, and he's taken a different attitude to things, and he's not even there's no joy in spending any time with this fellow, because he's always down on everything. So, nobody ever accused me of being having a great outlook on life before I got cancer. It has a way of changing things. Peter said it earlier, and I think Audrey said it. Yeah, it sucks to get cancer, but I'm still here after 6 years, and I was really not supposed to be. So, I might still get mad. I'm still me. I still do stupid things, but I wake up every morning thinking, yeah, I'm still here. It's got to be not a bad day. Even through dreary Nova Scotia summers or springs, it's still better than the alternative, so to speak.
Yeah, that's great.
Yeah, I'd like to add too, the health anxiety is definitely there. It is present. Like Peter said, every headache, every back pain, I'm like, okay, like, where is it now? And the funny thing is, I was like, throughout mine, I was everything wanting to not have my bladder removed. Like, okay, what's next? How do we not get there? And the funny thing is, once mine was removed, anxiety actually did get a bit better. Because it was like, okay, the cancer's out of me now. Yay. So I actually, when I hear the people that have been going through it years and they have to wait for the recurrences and they have that anxiety before their scans, the scan, it's hard. It's exhausting and tiring. And you do have to kind of look for ways to, help with anxiety, like whether that's meditation or yoga or hobbies or whatnot. But you really do have to practice those things. Find something that you like and keep with it, and try something new. But I think without it, the anxiety it's there. It's like you have it. You just have to learn how to cope with anxiety.
The pre-scan anxiety.
Yeah, always. Yeah, I get it now. Even, I've been basically NED since 2021, but now I'm like, oh, it's gonna come back as something else. Like, what's this pain? Like, why am my stomach hurting so much? It's there. And then, you're still having your 6-month scans. So I'm like happy that the cancer is taken out of me, but then I don't know, it's there. So you can't stop living your life. Like, that's so you have to learn definitely some coping strategies.
I'll say again too, yeah, it's I've been so thankful, and it's so great that I haven't had a recurrence. And I found a new hobby. I love painting, so I started painting. Yeah, when I first had cancer,
Okay,
and
yeah.
I thought I'm going to focus on something else too, and
Yeah.
I love it. Yeah, so and I love my grandkids. I've got 8 grandchildren, and we do a lot of camping and all sorts of fun stuff, cruises, and it's great. It's great to be alive and healthy.
Great. Yeah, Ken.
Yeah, that's great that you know your hobbies, and I found the same thing. I'm a member of the Rotary Club here, and one of our members did have cancer, and I did let her know that I was diagnosed with cancer. And one of the things she told me was, Ken, the biggest mistake I made was telling people. And I said, why is that? And she said that certain people now would avoid her. They didn't know what to say to her when they saw her. They were awkward with her. And I took that advice to heart. And I think I only told 5 or 6 people that I knew. And it was actually one of the best advices that I did receive from somebody who had cancer, because I can see how that could happen. People do know that I had cancer now, and I do notice that people do care, and they do ask how you're doing. So, yeah, that was my experience. Some advice that I did receive.
Just to play devil's advocate to that, I have a lady in our group that did the same, didn't tell people, only a couple people. And she looks back and kind of regrets it because she actually did struggle through her journey. And she thought it might have been easier if she did share with a few people, to be able to help, in those times where she really needed that support. And I think it's because she's hearing, some of us say like, oh, I had my sister was visiting, or I had a friend that brought me a meal or something. When I was having chemo, it was hard, but a good pot of soup was great. So I think she looks back and wishes that maybe she did let a few more people know, so that it didn't feel as hard for her going through it. So, but I every person goes through it differently.
Yeah, for sure. Yeah, Peter.
I'd forgotten about this until this topic came up. When I was first started the treatment, my oncologist at Sunnybrook Hospital, she was just amazing. And I remember her telling me right at the very beginning, and it's something that didn't quite make sense at first, but I grew into it. And she said that I remember, they have their little stools in the examination room. She rolled over this little stool, and she's about the same height as Angela. And she kind of rolled over and she took both of my hands and she said, I want you to remember something. And I said, okay. She said, your body has cancer, but you don't. And I thought about that. And it, to me, that made it, I can understand that this is something that was happening to my body, but it wasn't something that had to happen to me as a person, that the two were separate. And I maintained that for through the whole thing. And I mean, an example of that was when the second surgeon who did an MRI and did CT scans and everything couldn't even find the secondary cancer. He said, you don't have cancer anymore. And I went, how can that be? And I remember he said, like, hey, what do you care? Go home, and I did go home. And I remember on the way back, I was driving and I phoned my daughter and I told her, I said, you're not going to believe this, but I don't have cancer anymore. And she went crazy on the other end of the phone. She was just, I could see her, just getting so excited. And I wasn't. Which was very strange. And I think that the reason was because whatever during the period of waiting for the surgery and going through the chemo and everything that I went through, I had got to a point of acceptance where whatever was going to happen, I was okay with it. So being told that I didn't have cancer anymore was not like open a bottle of champagne. It was okay, great. And because I got to that point of acceptance. I know this sounds a really strange thing to say, but there was another bladder cancer event thing that I went to, and they had a Q&A, and it was in this big auditorium, and they had one they asked everybody to say something before they closed, and I found myself saying that other than being sick, this was the best thing that ever happened to me. And it was, a lot of people came up to me and say, how can you say that? How can you say that? And prior to getting bladder cancer, like I own and operate my own business, I was incredibly aggressive. I was very materialistic. There was so many things that I was doing that, weren't probably not very good qualities, if that makes sense, But after I basically survived this journey of cancer, everything changed, like 180 degrees. Like I'm much happier as a person today now after my cancer than I was before my cancer. I'm not as materialistic. Things don't bother me as much as they used to. I don't get angry as much. I don't, it's not important. It's like, don't, as they say, don't sweat the small stuff. And I made mountains out of very small molehills, and now I don't even do that. I can't be bothered. Life's too precious now. But it took cancer for me to realize that and to get to that point. So thank you. Thank you.
That's beautiful. Thank you, Peter.
I would concur with that words. I agree with Peter on that one. In almost everything that he said. Well, I didn't operate my own business or anything along that, the personal stuff, but I agree with him. Once you accept it, I accepted that I had cancer, and I could very well die. And okay, well, let's see how this goes. Well, it's still going, and I've been cancer free for 5.5 years now, or I guess 4.5 years, and you still just keep going. It's part of you, but it doesn't have to be everything, and it shouldn't be everything. just something that you deal with. That's one of the things that I got into the habit of saying, oh, people say, oh, you've gone through so much. You've fought the good fight. You've fought cancer. No, I've never fought anything. I deal with cancer, and I
Yeah.
deal with it my own way.
Yeah, absolutely. Okay, just a few more questions. I really appreciate it. We have one question about brands for pouches. Do you have any recommendations, or can you share some that you've prefer?
I can start with mine. I tried a few of them actually until I settled on the one that I have right now. And I use the Coloplast Centura, I think that's how it's called, Centura Neo, light convex, one piece. If you call any one of the big Hollister, Coloplast, any of those, they'll send you out a few samples. I did it with all of the big ones in Canada. And that's the one I settled on. And what I did like about it is I found I actually had to use less things. Like, so in the beginning, the ostomy nurse gave me some paste, put this around. I found it made a mess on your stomach. I absolutely hated using it. Plus it stung. And then they give you rings. Like there's tons of things out there. Once I settled on this one, I actually was able to remove all things from it. So now it's it. That's the only thing that goes on. It's like it simplified things. But it might not work for someone else. Like I find your pouching systems is definitely trial and error. Find what works for you, and then if your skin works, because I had a lot of skin issues with mine, with rashes and everything like that. So I'd say this was the fourth pouch that I found that I actually didn't have an allergic reaction to. So once I found that, it was like, oh, okay, I'm not changing it up. I finally had good skin health. So I'd like to let people know, if you're having issues and you're having bad skin, any kind of redness or broken skin, like that pouch is not working for you. Let's try something different. Heal it up. I've healed mine up with calamine lotion, which not a lot of people use. Apparently that's kind of not something that like your nurse is going to tell you, but it works for me. That heals your skin, and then try a new pouching system. Like see what works. But you don't have to have, like, I know some people are like, oh, I just suffer through it. You don't have to suffer through it. There's like so many different ones out there, and you just got to find the right one. But the Coloplast for me was by far the best.
Okay, great. Peter, do you have a favorite you could share?
I use the same system. I use Coloplast, MeoClick, but mine is the two-piece. And that came about because I had a nurse coming to see me about twice a week when I first came out of the hospital, and she showed me how to change everything and clean everything. And at that point, I had another brand, and it was just a one-piece. And I said to her, it would be really nice. I said, can I put the bag horizontally, even though it was a one-piece? And she said, well, if you're going to do that, you better go with the Coloplast system, which is, one part stays on your skin, the other part just rotates. So that's how I discovered that. But I agree, Coloplast is amazing. You phone them about anything, and they'll send you samples very quickly. They're very good. And one thing that's totally unrelated, but I just want to bring this up, which I didn't know, but I just did my taxes, and I had a new accountant, and he told me, which I didn't know, that you can get a disability tax refund if you have a stoma. And apparently it's quite a considerable tax benefit. And if you pay taxes, so that you actually get a refund. And so I've applied. I haven't applied. I'm in the process of applying for that. So, yeah.
Well, that's another. You're tying it all in. We're doing a guide for the disability tax credit. We're going to have an ostomy nurse explain exactly how to fill it out to be successful in getting that disability tax credit in July. And oh, it's retroactive too.
Yeah,
So I've heard of people getting a very large lump sum because they applied after a while. So that's nice to know too.
If I can say, one of the things that you must do when you apply is make sure you check the box that you're willing to have them check your taxes backwards. And I was just speaking to somebody on another bladder cancer thing not long ago, and they went back 10 years. And boy, did he get a check. So it's very important to make sure that you check that box.
Yeah, absolutely. We have one volunteer who said he put a down payment on a house because of his disability tax credit. So
it's huge. It's huge.
This is a question that I'm not sure anyone might know the answer to, but we just got it in the chat. Other than cigarette smoking or working with chemicals, has anyone been advised to what caused their bladder cancer? It's a kind of a tough question.
No.
Not that I'm aware of, no. One of the things I found in rural Ontario is that a lot of people were not aware that working with farm chemicals, for example, is one of the leading causes. And of course, we have a lot of farmers up here, and I was doing a lot of bladder cancer work at health fairs. And that's one of the things that people were not aware of, that working with farm chemicals is certainly one of the high danger areas for bladder cancer.
I worked for Toronto Fire. I was a fire inspector, and I'm aware that it's not common, but it is a disease that you can acquire in that line of work, and I guess other types of inspection works.
Yeah. There's definitely that's another resource we hope to build in 2025 is directly bringing awareness to firefighters and the career. Yeah, Angela.
For me, my urologist is thinking it's because of the constant UTIs I had my whole life. So it was always inflammation, and like I said, I was a catheter user, so those things were kind of tied in. But of course, he couldn't say exactly either what did it. He just thought with my young age and given the history of the inflammation with UTIs that was likely what did it for me.
Mm-hmm. Yeah, it's always pretty tough to determine a cause, right? Unfortunately. Oh, sorry, was someone going to say something?
Yeah, I was just going to say that my urologist, when he went in to take a look, before he even told me I had cancer, he said, "Do you smoke?" And I said, "No." And he said, "Have you ever smoked?" And I said, "Yeah." I said, and he said, "When did you quit?" And I said, "About 20 years ago." And he said, "Oh, well, there you go." He said, your bladder's full of cancer. Yeah. Yeah, he had terrific bedside manner. And I complimented him.
A plus.
The kind of guy you want to hang around with.
Yeah. Oh goodness. Okay. Have you followed any dietary or lifestyle changes after your diagnosis and treatment? Anything that you feel has helped?
I can say that, like, I know there's a lot of people out there who aren't familiar with the Indiana pouch, but the Indiana pouch does not like carbonated beverages.
Oh.
That's one of the things that causes it to sometimes create more pressure and tend to actually want to leak. So I've learned to avoid carbonated beverages. That's one of the things. And a friend of mine had the same surgery the same day in a different hospital, and believe it or not, his pouch is susceptible to green grapes. When he eats a bunch of green grapes, pouch reacts negatively. So it's a very weird world out there, but you'll discover those things as you go along.
Mm-hmm.
I'll just comment on, for me, I just became more health conscious. I try to eat more fruits and vegetables, and I want to be healthy and drink water and yeah, some of those things. And I was asked the same thing, did you smoke? And I said, no, I've never smoked before. So my urologist had no idea why I got bladder cancer.
Yeah.
I about two and a half years ago, I had a heart attack. And because everything medically is at Sunnybrook Hospital, my wife took me there. And it was strange because they put a couple of stents in, and I've been fine ever since. But they kept me overnight, and the next morning I had a meeting with my oncologist, and she. So I told them at the front desk, I said, like, could somebody get hold of my oncologist to tell her I can't make it? And about 30 minutes later, my oncologist showed up in my room, and we talked, and she told me something really interesting, and she mentioned that some people, that after they're given the all clear from cancer, they they think that they're almost indestructible and mentally, and so they pick up like bad eating habits, which is what I did, you know. Yeah, I would, if I started a bag of chips, you know, I'd eat the whole bag. And, you know, if they had poutine in the menu when I went to the restaurant, I'd do it. I did all the bad things that I wasn't even doing before, but I just did them. And they kind of caught up with me. So she said, so I, you know, had to make some changes and stop doing that kind of thing. Yeah. So, but she felt there was a connection between, you know, believing that you're indestructible now. I beat cancer, so I can eat that extra slice of apple pie.
Yeah, that's interesting.
Yeah.
Okay. So how did your partner or family react to your diagnosis? And what tips do you have for family members who may be, you know, affected by your diagnosis?
Well, as I mentioned, my wife had already gone through her own cancer journey. And at the time, our kids were in junior high and high school. So we were quite open and honest with everything that was going on with both her and when she had hers and then I had mine. And our kids were really quite appreciative of that. They, you know, they were young. I mean, I think my daughter was 13 or 14 years old. So maybe a little older than that. But anyway, as far as the kids go, because we were open with them, they have a whole different perspective on life than certainly I would have had. I mean, I grew up with 4 brothers. My parents just recently both passed in their 90s. We had absolutely no cancer in our family whatsoever until I was diagnosed. So, well, I shouldn't say that. My grandfather was in his 80s and he got bladder cancer. But he was a stevedore and smoked, and anyway, that was a long time ago. But anyway, as far as the kids go, you know, we were open and honest with them, and everything is, as I say, they've got a very different perspective on life than I would have had at their age. They're pretty well-adjusted kids, so I guess that's my story. That's the way my family has gone.
So being open and honest, that's yeah, that's tough as a parent, I'm sure.
There was no hiding. We had one friend that hid stuff from their kids, and it didn't end well because I mean, eventually it's going to come out. So
yeah. But I personally think that the support part of it is probably one of the most important parts of it, because without good support during your journey, it would be devastating, I think, because I had fantastic support from my wife and all my friends, and without that, I think it would have been devastating. But and the other thing I find that my work with Bladder Cancer Canada and talking to patients who want to know more information, I find that so rewarding. It's just a great thing that keeps me happy and busy. And I'd love to be able to tell people that, you know, it's not a death sentence, and there are certainly a lot of options. And, you know, don't look at it negatively. Look at it as you're just lucky they found it in time, and let's go with it. And ask every question you can think of. There are no bad or stupid questions, because I didn't know there was a lot of sexual implications on the cystectomy, and I wasn't given that information till after the fact. So it's very, very important to ask every single question, even if you think they're dumb.
Just to echo what he's saying, I think that's why joining the support groups is great, because a lot of the other people already know, like, oh, this is the question you should ask. I didn't know this. Ask this question, and you can kind of go in a lot more prepared, because you're like, okay, I have these questions now. These things are important, and they got a better head start, I guess, than maybe we had.
Yeah.
Yeah, Ken?
Yeah, I could not agree more with everything that anybody said. And I wish I had have known about Gilda's Club while I was getting treated, but I discovered Gilda's Club after, and what a good support group they have there. And I do want to say that, yeah, I spoke with my family about this as well, similar to Blair, and I have 2 daughters and 2 stepdaughters, and everyone was so supportive and positive, and we went into this being positive. And at the end of the day, I did the same as Peter. Actually, I phoned one of my daughters on the way home, and she was ecstatic. And funny enough, like you, Peter, it really had no impact on me. But it didn't. But the family was very supportive, and it really helped me along.
Okay. Great. Well, I think that's an excellent place to end it for today. So we hope you enjoyed this session. Next month, we're hosting a webinar on staging and grading called What's in Your Bladder Cancer Pathology Report, hosted by Dr. David Berman. And then in July, as I mentioned, we're hosting a webinar on the disability tax credit with Rosemary Hill, who's an ostomy nurse, and registration for that will open very soon. So in the chat, Shasa will share a link to register for these sessions, as well as a quick feedback survey that will come through email tomorrow as well. But we'd love to hear your thoughts on this session and any suggestions for future presentations. So please take a few minutes to complete the survey. And if you need any accommodations to complete the survey, or you have any additional comments or questions, you're always welcome to call us at 1-866-674-8889 or email info@bladdercancercanada.org. A recording of this session will be uploaded to our website in the next few days. So a giant thank you to our panel today. Angela, Peter, David, Audrey, Ken, and Blair. Thank you for your time and for your willingness to share. You really are an inspiration. You had such a great outlook on your experiences, and I really appreciate your openness tonight. And thank you everyone for attending, and I hope you have a great night.
You too. Thank
Good
you.
night, everyone.
Thank you.
Good night, everyone.